So if you do happen to walk into a home that has several, or you've been with a person that has progressed and now has several different pieces of equipment, whether it be a feeding tube or a suction machine or a BiPAP machine, whatever it may be, that you are unfamiliar with for whatever reason. Yes, I mean, asking questions is always first and foremost. So who can you go to, right? So what I usually encourage caregivers to do, healthcare professionals that are in someone's home, check with your company first. Check with your company first. Find out exactly what you can and cannot do, because under your insurance, you'll have various different liabilities, right? And so you may be able to prepare a feeding, yet you may not be able to administer it, right? And then clearly communicating that with, whether that's your agency that communicates that with your person living with ALS, or whether you feel comfortable having that conversation, because I realize that can be awkward sometimes, right? So sometimes it can be helpful if your supervisor, depending on the situation. So, okay, so say you find out, okay, yes, I can do some things, yet I have no idea how to do them, okay? Asking your person, first and foremost, okay? Because granted, they may have particular specific ways that they even like things done, okay? Different than, say, if you came to me as a nurse, that I might teach you to do it, which is, say, best practice, they still may have things that they prefer, okay? Which is totally fine, okay? So then, talking to your person that's living with the ALS, and then also strategizing together, okay? So I want to be able to do this for you and help you with this. So should we call the company? Should we call the nurse at the clinic to advocate for us to call the company to come out and show me how to use this? Because that is not uncommon. That is not uncommon that we will call even have a physical therapist, a separate physical therapy visit from a home care company, come out specifically to teach on this and this and this, on the Hoyer lift, right? How to use this. It's not uncommon that we will call and request, can a respiratory therapist come out and just show them how to use the BiPAP machine, even if they can't touch it, just so they have some awareness as to what's happening with it. It can always be helpful. So yeah, so again, it's using your resources, right? And also knowing what's within your bounds and what you feel comfortable with. And I think that's another piece, is being able to share with your person that you're working with what you do feel and don't feel comfortable with. And then that's a conversation for you both to have, right? So to really know internally, like what your own limits are, and levels of comfortability.